Case number 1. This is a relatively young person who comes into the emergency department with near syncopal episodes. The patient has been feeling episodes of lightheadedness, and by history, the patient recently started some new antipsychotics just within the past day or two. Looking at the 12-lead ECG, what you notice is that the patient is going in and out of an irregular, wide, complex rhythm. And what you're looking at here is episodes of ventricular tachycardia. They're wide complexes, but the morphology is changing, so this is polymorphic ventricular tachycardia. There's 2 types of polymorphic ventricular tachycardia. One of the types is associated with acute coronary syndrome, but the other type is associated with a prolonged QT, and that is referred to as torsade de pointes. This is the type of polymorphic ventricular tachycardia that's not associated with acute coronary syndrome. This typically is associated with various electrolyte disorders, for example, hypocalcemia, hypokalemia, hypomagnesemia. Hypothermia is associated with prolonged QT, elevated intracranial pressure, and there are many, many medications that can produce this pattern as well, and also congenital prolonged QT can produce this type of polymorphic ventricular tachycardia. Once again, the key thing to remember is that torsade is a type of polymorphic ventricular tachycardia that's associated with the prolonged QT, and your treatment is going to be focused on reversing the cause of the long QT. The other types of polymorphic ventricular tachycardia are typically associated with acute coronary syndrome or sometimes Brugada syndrome. And how do you make that distinction? You've got to look at the QT. And you can get a sense here that this patient's QT is long, and that's why you should be thinking about the torsade type of polymorphic ventricular tachycardia. There's a few key sex-specific teaching points that we need to cover. First of all, women have a longer relative baseline QT compared to men after puberty. So they're going to be at a higher risk for torsade, especially higher risk of the drug-induced type of torsade. There's many commonly used medications, for example, antiarrhythmics, antibiotics, antipsychotics, and so on, which increase the risk of torsade more in women than in men. So your question, which sex accounts for 2/3 of cases of drug-induced torsade?